Liver transplants. In 2016, cirrhosis and liver disease were the ninth leading cause of death for males. Liver transplants are a life-saving intervention for patients with acute or acute on chronic end-stage liver disease. It is undertaken as a treatment of last resort when all other options are refractory, and it could extend lifespan by up to 15 years. In this presentation, I'll begin by providing an overview of liver anatomy and physiology, a description of frequent pathophysiologic processes affecting it. Drawing onwards from that, I'll then move on to describe the leading cause. In 2016, cirrhosis and the liver is the largest organ of the human body. It's located in the right upper quadrant, underlying ribs 8 to 12 approximately. The liver is anatomically divided into two lobes, a large left lobe and a small right lobe. These two lobes are divided by the falciform ligament, which is attached anteriorly to the inner lining of the peritoneum. So the liver has far too many functions to be able to cover with the detail that it deserves for the scope of this article. But it does have four main functions that are mainly related to its role in digestion and the metabolism of the human body in terms of maintaining homeostasis. These four functions are bile production, storage and metabolism of fat-soluble vitamins, drug metabolism, and bilirubin metabolism. So, to cover these briefly, bile is produced by the emulsification of fats, basically allowing them to be either absorbed by making them water-soluble, otherwise they would not be absorbed, or they could get recirculated into the circulatory system, where they would pass through the digestive recirculated into the GI tract, where they would be reabsorbed, and then metabolism of them a second time would be easier. Vitamins A and D3 are also produced in the liver, and a very important function of the liver as well is the conjugation of bilirubin, which transforms it from a fat-soluble into a water-soluble compound that allows it to be excreted. Bilirubin is formed from the breakdown of red blood cells, and a dysfunction in the metabolism or in the conjugation of bilirubin and its excretion causes it to build up, causes a hyperbilirubinemia, which is an excess of the fat-soluble version of the compound. This gets attracted very easily to skin, muscle, connective tissue, the sclera of the eyes, and things like that, and that causes jaundice in patients with severe liver failure. A multitude of conditions are considered to be indications for liver failure. However, a common theme present in all of them is the presence of either cirrhosis or liver failure. So these two things could be caused by a number of conditions themselves. Acute liver failure things like drug overdoses, cirrhosis from chronic liver failure, like alcoholic liver disease, cancers of the liver, hepatocellular carcinoma, uh, ascites, which is a disruption in the hepatic portal circulation that does not resolve with its normal treatment, and hepatic encephalopathy that does not resolve with normal treatment with electrolytes and diuretics and things like that. There's also a number of genetic conditions that can cause a patient to require liver transplant. These are much more common in younger patients. So, like any organ transplant, evaluation for a liver transplant has to begin by blood typing and making sure that there is a cross-match compatibility between the donor and recipient. Um, Without this step being performed and confirmed to be compatible, everything else does not matter. However, once that is completed, there's also a number of other evaluations which are performed. These include an evaluation of liver function, as in the patient's current liver condition, cardiopulmonary function, infectious diseases, as well as cancers being occurring outside the liver or cancers outside the liver that metastasize to the liver. So typically a patient with severe congestive heart failure, malignancies of, say, lung cancer, things like that, typically these would not be considered as good candidates for a liver transplant. Another important thing is the evaluation of the patient's psychosocial status. So a liver transplant is something that will require lifelong treatment, lifelong intensive and strict regimens of treatment that require them to be followed very, very, very accurately. Otherwise, problems could occur. So, as such, contraindications for liver transplants include an abnormal or acute finding in any of the above areas. Patients with AIDS are not considered as candidates due to the immunologic suppression caused by the syndrome, as well as patients with an acute medical condition that could be caused by the liver but does not resolve or is not able to be fixed easily. So things like sepsis, acute liver failure with sustained encephalopathy. So these are typically patients that would most likely be obtunded, having a GCS less than 15. They would not be awake, alert, and oriented. That also brings up issues like consent, things like that, and there is no indication to transplant a liver into somebody who will not survive regardless of whether they receive a liver transplant or not. So there's two main forms of liver transplants. There's the conventional form, which uses a deceased donor. There's also a newer living donor transplant. This one is really interesting. It's performed via a partial resection of the donor's liver. About no less than 30%, no more than 70% of the donor's liver is resected. Of course, that has to be matched in terms of its size and weight, anatomically speaking, with the recipient's body as well. Otherwise, it will not fit. And in a healthy person, even after a partial resection of of their liver, it could still grow to its complete complete volume prior to the surgery within no more than 6 months. Actually, most growth occurs within the first 2 to 3 weeks after surgery. So, uh, in this regard, it's a fairly easy condition or easy procedure to perform, given that there's always a lack of adequate donors, as well as a high demand for liver transplants. So, for this part, everybody just make sure you're an organ donor. Saves lives. Complications after transplants could be early or late. Early complications could be a graft rejection or non-function, and acute cell resection. These are typically very serious medical conditions. Also, a development of a thrombus in the hepatic artery, which is also a very serious medical condition. Could also cause ascites and a recurrence of liver disease. Disruptions in biliary function as well as infection are also common complications. Late complications are usually those that are related to the chronic use of immunosuppressive drugs. These are usually uh, things like chronic kidney disease, hypertension, diabetes, and dyslipidemia, as well as some neurologic conditions. Prognosis for liver transplants are generally positive. It's about 79% at a year. Uh, Goes down to about 50% at 15, which, given the age in most uh, patients that require liver transplants, that is a relatively optimistic prognosis. Of course, like any other medical condition or procedure, there's always a a variation or a wide range of prognostic values dependent on age, sex, patient's medical condition, and things like that. Most common cause of death, however, was infection, which was followed by either a recurrent or new malignancies, so a development of a new cancer or a relapse in or a recurrence of a previous neoplasm, as well as cardiopulmonary diseases. Uh, these could also always be age-related complications, which are heavily involved in the are usually heavily involved in the death of liver transplant.